Hi teachers, we're your school nurses and today we're here to talk to you about asthma. Before we get started, we're going to go ahead and introduce ourselves. My name is Jessica Red.
I'm Kayleen Lawler.
And I'm Leanne Danapor.
My name is Doreen Taylor.
And I'm Gloria DeRonio.
Okay, so I want you to imagine that you're in your classroom, you're teaching your lesson, everything's going well, everyone's doing what they're supposed to, everything's great. Then you have a kid at the back of the classroom, she raises her hand and she's like, excuse me teacher, this kid next to me says that she's having a hard time breathing, but she doesn't really want me to say anything to you because like she doesn't have her inhaler with her, but she doesn't look good. So you walk to the back of the classroom, you go talk to her, and she really does look like she's probably having a hard time breathing. So what are you going to do? This is a scenario that we see often, and we'll talk about more as we go along. But before we get into that and before we finish the scenario, we're going to talk about some of the information that you need to know about asthma. So I'm going to go ahead and turn it over to Kayleen, who's going to talk about what is asthma and the symptoms that you need to be watching for.
Thanks, Jessica. Asthma is the most common health condition among our students. It is a condition where the airway becomes inflamed, swollen, and has increased mucus production. Symptoms of an asthma attack include difficulty breathing, audible wheezing, or sometimes they can be wheezing and you can't hear it unless you have a stethoscope, so you need to be aware of that too. Complaints of chest tightness, rapid breathing, speaking in 1 or 2 word sentences, clearing the throat, and persistent coughing. They'll be anxious, and they may have blue coloring around their lips or eyes. On the slide, you can see there are a lot of triggers that could cause an asthma attack. I'll just go over some of the main ones that we see. Exercise is a big one. And even though exercise can be a trigger, we still want our asthma students who have asthma to participate in PE. They may need to self-limit, or you may need to check with the nurse to see if there's orders for an inhaler that they should take before PE class. Another common trigger is air quality. Being in the Central Valley, we have lots of orchards, and so we have the blooming season, we have the harvest season. All of those seasons cause a lot of changes in our air quality. Hot and cold weather are also big triggers. And lastly, allergies and illnesses such as colds and coughs are big triggers for our students who have asthma. Now I'm going to turn it over to Leanne, who's going to talk about the treatments and why it is important as an educator to know about asthma.
Kayleen. So now that we know the signs and symptoms of asthma, we're going to briefly talk about how we can manage asthma for our students in the classroom. So there are 2 main types of inhalers that our students may be using in your classroom. One is what we call a rescue inhaler, and this is what most of us are familiar with. This is used for really an acute asthma attack. An example of a rescue inhaler would be albuterol. Then we have what's called a maintenance inhaler, and this is used for chronic asthma, and it's really to control the asthma attacks from occurring. Most of the time, we don't see this type of inhaler at school. It's used at home for the most part. We don't expect you to know all the differences between the types of inhalers, but what we do ask is that if you do see a student in your classroom who is reaching for an inhaler and you have not been notified by any of the nursing staff that you have a student with asthma in your classroom, well, we ask that you contact a nurse, let them know the situation. That way we can reach out to that student and their family, make sure that we have the proper documentation in place, medication forms are filled out, and that medication is appropriate for that student. So as Kayleen said, asthma is the leading chronic illness amongst children and adolescents in the United States. And chances are that at some point in your career as a teacher or at your school site, you will encounter a student who is having breathing difficulties or an asthma attack. So we hope that throughout this presentation, you develop the skills and the confidence necessary to support those students at your school. To maximize learning, our students need to feel safe and secure at school. To accomplish this, it's important that we as educators are aware of their individual health needs, which will allow our students to remain engaged and focused on academics and their learning, and not have to have that fear of having an asthma attack at school. So, as we said, asthma is the leading cause for chronic illness amongst children. And because of that, it's also the leading cause of absenteeism amongst children. So in a class of 30, on average, you will see about 3 students in that class who have asthma, which is about 10% of your class. Students who have chronic absenteeism also, studies have shown, have lower rates of reading proficiency. Lack of reading proficiency in 3rd grade is a huge risk factor for not graduating high school. So it's really crucial that we support these students with asthma appropriately so that they can stay in school and not be sick at home. It's also important as administrators, as teachers, as office staff, as yard duties and other school staff that we can work in conjunction with the school nurse, and together we can ensure that our students have a healthy and safe school environment. Now, Doreen is going to talk about how you can work together with your school nurse regarding your students with asthma.
Thank you, Leanne. So let's look at some examples of ways that your school nurse can collaborate with you. One is the school nurse will work with the family and healthcare provider to ensure we have the proper documentation for the medication. We'll meet with staff to review those medications and provide you with the medication administration training. The school nurse will also create a care plan and/or emergency plan to make sure that all staff know what to do if the student is having an asthma difficulty or showing other signs of distress. The school nurse will also monitor the effectiveness and the usage of that medication while at school. As Leanne mentioned earlier, the expectation is not for you, the teacher, or the staff to know all the medications, but to be aware if your student is using the asthma inhaler every single day after PE, every single day after recess, or more than twice a week. Please share that with the school nurse so that we can work with the student, family, and healthcare provider to ensure that the student has the most effective asthma medication regimen, because remember, we're here to help you. Lastly, if at any time you have any concerns regarding your student with asthma, let us know. We can help work with you to help with academic problems, attendance, health, or anything else. Let your school nurse know when a concern comes up, and we'll make sure that we have the appropriate plan in place, or is to alert us that maybe we need to change the current plan. I'm going to turn it over now to Gloria, who's going to talk more about what to do in an emergency situation.
Thank you, Doreen. So if you find yourself in a situation where your student is having an asthma attack, reach out, get into your emergency plan, pull it out and use it. It's going to require the use of the inhaler. The hopes is that your student and you already know how to administer the medication, student knows how to use it, and that the medication provides immediate relief. If you find yourself in a situation where you don't have an emergency plan, there are 3 key steps that I need you to keep in mind and remember during an emergency situation like this. First, you're going to get help. If you are the only adult in the classroom, you're going to want to call the office from within the classroom. If you do not have a phone in the office, you're going to send a student to the office to get help. Second, you're never going to leave a student who's having an asthma attack alone. You always want to be present so that you can provide the student needs as the student's needs are changing. Third, you're going to want to have the student be placed in a position that optimizes their breathing. So this is called the tripod position, where you have the student sit straight up with their shoulders relaxed, leaning slightly forward with their hands resting on their thighs or their knees. Once help arrives, you're going to ask the additional staff to notify the parent and to notify the school nurse. While you're with the student, if you see that the student's condition is worsening and they're turning blue or they stop breathing, you're going to have them call 911 while you provide CPR. In regards to all of this, you're going to want to report all of these situations, these type of events, to the school nurse so that she or he can put everything that's needed in place before your student returns. I will now hand it over to Jessica, who will continue the presentation.
Thanks, Gloria. So let's look back to that scenario that we talked about at the beginning of this presentation. So you just got to the back of the classroom. You're now with that student who looks like she's having a hard time breathing. So if we follow this scenario, the first thing we want to do is get help. So when we go to get help, we want to make sure that we have an accurate depiction of what is going on. So at this point, we've already asked the student if she has an inhaler with her or where it might be. And like she said, she had forgotten it today. So we call the office. They let us know that she actually has an additional inhaler in the office. And so the office is now going to bring that inhaler to her. This not only gets you her inhaler, but it also gives you another adult in the classroom. So that way you're not the only adult. While you're waiting for this inhaler, it's a good time to sit with that student, help her get into a position that's comfortable and optimizes her breathing, and help keep her calm. While this situation wasn't ideal from the beginning, the outcome wasn't too bad. We had an inhaler for her, she used the inhaler and it worked, and everything was okay. But what if we didn't have an inhaler for her? What if she used her inhaler and it didn't work? These are some of the reasons why we want to make sure that we get help out to that classroom, because if you end up in a situation where the situation is worsening, you don't want to be the only adult available. So now if the situation had worsened, the other staff members that are with you could call 911. They could alert administration that this was going on. They could make sure that gates got open for EMS and that they could make sure EMS was directed to your location. So always get help, because then you're not the only adult, and we can make sure that all the resources necessary get to that student. So before we wrap up, you guys have 2 handouts in front of you. The first handout is a basic overview of what to do in an asthma situation. This is not for students that have an inhaler at school that we know about, or they have an action plan or an emergency plan on file. If they have those, you need to follow those first, and those are always going to trump this form. But if you don't have any documentation on the student, this is a great step list of what you can do in a situation like that. Another thing that's really nice about this is that there is no personal information on it, so you can hang it up in your classroom or put it somewhere where it's really easy to access and you don't have to worry about the confidentiality of the information. The second form that you have is of different myths about asthma. Everyone has different preconceived notions about asthma, opinions, thoughts, whatever. And so this just kind of goes over some of the most common ones that we see, and then what you can do or what the scientific answer is about those myths. So you have both of those that you can look over when you guys have time. And at this time, we'll take any questions that you may have. And otherwise, that's all the information we have for you guys. Thank you.